Well, good morning, everyone. Welcome to another chiropractic boot camp. What we're going to be going over today is one of my very favorite topics, of course. We're going to be basically hitting three things. Number one, what is chiropractic care? What are the myths? And then we're going to explore the research behind safety and the effectiveness of chiropractic care. This lecture, by the way, is being videotaped, and at the end of the lecture, you'll be instructed how to receive a copy of the actual video and also the PowerPoint presentation that goes along with this video. But before I get into it, let me just tell you the reason we're doing this video in this lecture is simply because there is a need for good quality information out there about chiropractic care. And understand, whether you are a medical physician watching this lecture today, whether you are a chiropractor, an osteopathic physician, a chiropractic physician, a nurse, a dentist, an optometrist, a massage therapist, a patient, or a legislator, whoever you are, understand our main goal, and you'll see by the end of the lecture, our main goal is quality, making sure we deliver quality, safe, and effective chiropractic care. It's all about our patients. That's why we do what we do, and that's what we're going to talk a lot about today. All right? Prior to today, interestingly enough, somebody sent me a link to a video, and that video featured a chiropractic critic, an MD anesthesiologist, who delivered a very scathing attack on this profession. And as I watched this video, to tell you the truth, I was very bewildered. And why I was bewildered was simply because his description of this profession was not even remotely similar to my real life experience of being a chiropractor for 26 years. And by the way, in case I didn't say it, I'm Dr. Ronald Farabaugh. I am a chiropractic physician from Columbus, Ohio, and we teach a seminar called Chiropractic Boot Camp. But anyway, I've been in practice 26 years, and as I'm watching this video, it's just hard to understand how there could be literally millions of documents out there related to research in textbooks, papers, millions of documents talking about and discussing all aspects of chiropractic care and the chiropractic profession in a very positive way. Yet this particular physician was somehow able to come up with 6 to 12 statements taken completely out of context, and using those 6 or a dozen statements completely discounted the benefits of chiropractic care. And I just thought, how is that possible? What was his motivation? Because in the video, he talked about how he has spent thousands of hours, literally thousands of hours, talking to chiropractors, emailing chiropractors, interviewing chiropractors, and he actually posed as a student one day on a chiropractic campus, Palmer College out in Davenport, Iowa. And of course, that makes him qualified, right? But the video, it looked like an air of legitimacy. I mean, it looked like it was from the University of Oklahoma. It looked legitimate, but the information was so completely counter to my real life experience and what I experience every day with my patients. And I started thinking, now how's that possible? I learned a long time ago, follow the money trail. And it just did not take very long, folks, to find out where this money trail led. It turns out at the end of the video, he openly disclosed that he's working with some attorneys and a bunch of lawsuits. And I just shook my head because the entire credibility of the video, if there ever was any, just completely disappeared, knowing that it was all about the money. So today, we're going to be talking about chiropractic, and I'm going to do the Paul Harvey thing and give you the rest of the story, the inconvenient truth that many of the chiropractic critics just simply don't want you to know about. To start with, let me talk about initially bigotry and discrimination. Because anytime you run into a physician, anybody, not just a physician, anybody that simply discounts 60,000 practitioners with a simple statement that chiropractic care is not beneficial or whatever, I got to tell you, when it comes from a medical physician, medical bigotry and discrimination is as perverse and irresponsible as is bigotry and discrimination based on religious persuasion, race, sexual orientation. It is crafty, it's sick-minded, and it's evil. It harms patients who then choose more dangerous forms of health care because a particular physician might have struck fear in them and chased them away from chiropractic, something that could have helped them without drugs, without surgery. And I'm not suggesting for a second drugs and surgery aren't necessary at times, because of course they are. But this latest attack on our profession is just reminiscent of what occurred in the 60s and 70s, when the American Medical Association actually formed a committee to contain and eliminate the chiropractic profession. And that culminated in 1987 when Judge Susan Getzendanner in federal court found the AMA guilty of a conspiracy to contain and eliminate the chiropractic profession, guilty of antitrust. Those days are long gone, or should be long gone, but this latest attack is just so reminiscent of that era. Their weapons back then were name-calling, misinformation, political and financial influence. But there is some good news. The good news is the contemporary medical physicians of today have grown way past that period in our history and routinely work with chiropractors in their area. In fact, in my own practice, a significant percentage of my practice comes from referrals from local medical physicians. We enjoy a very healthy, cooperative relationship, and I'm going to encourage every physician of every type. Patients today, the conditions are so complex, the issues are so many, nobody does it all. Patients expect, patients need a good multidisciplinary cooperative effort for the good of our patients. That's what they need. So let's start with today's topics. I'm going to really talk about three things. One, exploring the myths, and then we're going to talk about safety of manipulation, and then the efficacy of chiropractic. We're going to review the literature. Let's start with the first myth. The first myth. According to the public, the chiropractic's perception of the public, or the public's perception of chiropractic, is that chiropractic is an advanced form of physical therapy. Answer, no. Chiropractic physicians are primary care physicians. PTs are simply not. Now, at Ohio State University, for example, physical therapists now have a Doctor of Physical Therapy program, and it's wonderful. They've really increased their educational efforts. There's two different directions a physical therapist can take. One is the neurological program, and one is the musculoskeletal program. In the neurological program, there's no manipulation learned. In the musculoskeletal part of that program, if they choose that, there is some manipulation. Not a lot, but there's at least some. In 2008, if you were to ask what the definition of chiropractic is, I would turn to the definition by Dr. James Winterstein he's a college president. His definition is this: the treatment of human ailments without the use of prescriptive drugs or operative surgery. That's what chiropractic is in 2008. Chiropractic, keep in mind, is a profession. It's not a treatment. So when somebody says something about there's no research on chiropractic, I don't know what that means, because chiropractic is a profession. It's like saying there's no research on the medical field. What does that mean? What aspects of the medical field are you talking about? Same thing with chiropractic. The second myth, chiropractic in 2008 is not much different than it was in 1895. That's another thing I hear sometimes, the response. There's been a concerted movement towards evidence-informed practice by all physicians, including chiropractic physicians. The history of how chiropractic started way back in 1895 with D.D. Palmer, let's face it, that's a very interesting story, but it's just not relevant in 2008. I mean, how many of you all have had patients come in and say, okay, now I want to talk about my problem, but first I want to talk about that thing that happened 113 years ago. It's irrelevant what happened 113 years ago. Just remember, in that time period, that same time period in medicine, medical doctors got licensed. How? They rode around town with the town doctor, and when that town doctor decided you were ready, boom, you are now the town doctor. There was no credentialing, there was no licensing, there was no education, there's certainly no research. At that period in time, medicine was about, medicine included bloodletting, purges, leeches. Again, what's the point? It's irrelevant what happened 113 years ago. Who cares what happened 113 years ago? It's just not relevant today. The next myth, there's no such thing as a subluxation. The reality is that entire discussion is basically irrelevant in 2008. Let's consider some terms that are kind of common. I mean, what we chiropractors in the past may have called subluxation, the very same problem that patient has, the osteopaths might call osteopathic lesion. We may call it a subluxation complex. Somebody else might call it a functional lesion. I think the most common term is spinal dysfunction. That's probably the most accurate common term today, spinal dysfunction. It really doesn't matter what the term is. The question is, what's causing the patient's pain? That's the only question, really, right? And if you look towards one of the most well-researched medical physicians in the world, Nikolai Bogduk, in paper after paper, he suggests the source of pain in the person's spine is from two sources. The disc, second source, the facet joint. Now, guess which two types of tissue are the most affected by spinal manipulation? You guessed it, the disc and the facet joints. Let's just talk about subluxation just for a little bit more, though. I want to talk about the three phases of our history. The first phase was back in 1895 when D.D. Palmer did an adjustment to this deaf janitor named Harvey Lillard. And based on the unbelievable results he got, restoring this man's hearing, as the story goes, he coined the term subluxation. But again, that was 113 years ago. Since then, more modern chiropractic in the last several decades have basically defined it a little bit differently. Chiropractic is a clinical science, as is medicine. Chiropractic is a clinical science really based on four things. Number one, the law of homeostasis. Nobody questions the law of homeostasis. If you get cut, you heal. If you break a bone, you heal. If you have a temperature, your body's trying to bring it down. Your body is constantly trying to return to normal. Nobody questions that. The next is the theory of the nervous system, which simply says there's a system in your body called the nervous system, whose function it is to control and coordinate all the other functions of the body and relate the internal and external environments. And again, the theory is really unquestionable. If you've ever done any research on the spinal column and the nervous system, you understand how absolutely delicate and how magical and how intricate it is. The next thing is hypothesis. There's a hypothesis that says there's a relationship, a close relationship, between the spine and the nervous system. And a dysfunctional spine, a spinal dysfunction, can irritate that nervous system. And if you even do a scant review of the literature, you'll find that also to be true. Obviously, spine problems can cause nerve irritation and nerve problems. In the worst cases, we refer those to a surgeon if there's a compressive lesion. But according to the literature, 97% of all back pain is mechanical in nature. In other words, the joints are just tight. And if you understood the neuroanatomy and the physiology related to those joints and an integral close relationship of those joints to the nervous system, you would have a better appreciation of the importance of the spine. And lastly is the premise that there is a relationship between the nerve irritation and ill health in your body. If those nerves get irritated, you can have ill health. And I think that's what leads to a lot of consternation in our profession and in the medical profession, because back in 1895, in the zeal of that new discovery, you heard things like chiropractic care can cure everything but rigor mortis. Well, no free-thinking chiropractor has thought that for 100 years, but that still gets brought up all the time. The third phase in our history is what we're into right now. In 2008, it's all about evidence. Chiropractic physicians are evidence-based, evidence-informed physicians. It's all about function when it comes to the spine. Function is king right now when it comes to the spine. Chiropractic physicians examine and diagnose and either accept their patient for treatment or refer them out. That's modern chiropractic in the year 2008. DCs use the clinical predictive role, patient selection criteria. In other words, if we can help somebody, we tell them. If we can't help them, we're going to tell them that as well and make a proper referral. But bottom line, the whole issue of subluxation, let's face it, it's just the word. If we never use the word anymore, it doesn't change the problems our patients have. The question is, who's got a good treatment for those problems? That's the question. If we look at Gray's Anatomy is basically the same anatomy book. It's about this thick, weighs about 20 pounds, it seems like, and it's the same book that all medical colleges, osteopathic colleges, chiropractic colleges use. I just want to read you one line from page 764 of the 35th edition. Now, the 35th edition is what I learned from back in 1982 when I graduated. So there might have been several editions since then, but the fact is, let me read you this line. The human nervous system is, without question, the most complex, widely investigated, and least well understood system known to mankind. Its structures and activities are inseparably interwoven with every aspect of our lives, physical, cultural, intellectual. That was true back in the day when Dr. Gray wrote his first textbook. That's as true now. That hasn't changed very much. It's withstood the test of time. In other words, our bodies, if you want to get a real good appreciation for it, read the book called Molecules of Emotion by Candace Pert, or maybe The Language of God by Francis Collins. If you read those books, you're going to get a whole new appreciation for how our bodies have evolved and how absolutely intricate they are, and by design. It's an amazing thing. All we have to do as human beings is not interfere with it. If we just let our bodies do what it's supposed to do, and we don't dump toxins and chemicals into it, and we take care of our frame, we exercise, then we're going to be in good shape. If we let those things go, that's when we wind up in trouble. The word subluxation, again, let's just change the word if we have to, or think of it differently. Subluxation simply is the same as spinal dysfunction. That's what I'm going to refer to at the rest of this lecture. Spinal dysfunction results in the most researched things that we know about: lower back pain, neck pain, headaches. Those are the three most common ailments that occur as a result of spinal dysfunction, and the three most common ailments that have the most amount of research when it comes to spinal manipulation and its effect on those three conditions. Now, those three conditions, by the way, just lower back pain alone, look at that statistic. It afflicts 76% of the people annually and 85% of the people in their lifetime, and has total costs of $84 to $624 billion worldwide. Lower back pain is huge, and the question is, who can treat it the most effectively? Let's look at what some of the research shows: spinal dysfunction, low back pain, and manipulation. In a report by J.C. Smith, a noted author and lecturer and chiropractic physician in the United States, he noted that back pain management has been assessed by government agencies in the United States, Canada, Great Britain, Sweden, Denmark, Australia, New Zealand. All of these reports are highly positive with respect to manipulation, spinal manipulation. There is so much research out there today that no one seriously questions the benefits of spinal manipulation. Dr. Tony Rosner, formerly the Director of Research at FCR, which stands for the Foundation of Chiropractic Education Research, he stated that today we can argue that chiropractic care, at least for lower back pain, appears to have vaulted from last to first place as a treatment option. Just remember, the Rand Corporation years ago did a study, and they found that 94% of all manipulation is performed by chiropractic physicians. So we have an incredible role to play in one of the most costly ailments that our society has to deal with. Let's look at a few more myths. How about this one? I love this one. Chiropractic is a bunch of voodoo and nonsense. You ever have anybody say something like that? Well, the reality is it's a senseless statement. If you ever hear anybody say that, frankly, you can just pretty much zone them out and ignore them, because they clearly never looked at any research. Chiropractic is a profession. It's not a treatment. Chiropractic is a profession licensed in all 50 states. The next myth: chiropractors think they can cure everything from lower back pain to HIV. You ever hear that one? Well, every time I've heard a ridiculous statement like that, I always challenge the person who said it. You chiropractors think you can cure everything. And my challenge to you is this: show me one, just one. Just show me one person anywhere, one chiropractic physician anywhere that thinks they can cure everything with a manipulation. Again, this is not 1895. We're 113 years later. Nobody that I've met in my 26-year career thinks that way. So it's not really even worth discussing. More myths. I love this one. Heard this one lately. Chiropractic is a cult. Well, obviously that deserves no response. It's ridiculous. Most MDs today have risen above that low level of medical bigotry. And again, I'm proud to say that we have a very close working relationships with a lot of area medical physicians. And most chiropractic physicians I know across the country have nice, close relationships with medical physicians. And if you're a medical physician watching this video, I would strongly encourage you to go out and seek a chiropractic physician that's an evidence-based, evidence-informed physician, which there are many, 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 the vast majority of our profession, of course. But that is just such a ridiculous statement. This is another interesting one. Manipulation used by physical therapists and DOs are more gentle and controlled. Well, I never quite heard that or understood that, because the reality is the quality of manipulation is completely dependent upon the quality of the education. And would you rather consult someone for manipulation who has gone to a weekend seminar, or maybe had one class in school, or maybe watched the video and set up on 20 patients? Is that who you want to be manipulating your spine with that delicate nervous system associated with it? Or do you want to go to a physician who spent 3 to 4 years in college learning manipulation and honing the skills of manipulation? The fact of the matter is, the fact of the matter is, anybody can do manipulation, but not everybody can do it well. You want to get to somebody who does manipulation primarily, and they're good at it. I got to tell you, a really good, for example, osteopathic manipulator can be absolutely every bit as good as a good chiropractic manipulator. That's just the reality of it. Chiropractic adjustments tend to be a little bit more directed, a little bit more precise, where a lot of other manipulations are a little bit more general. And the reason I can say that is one of my very best friends is a osteopathic physician, and I think he would probably support that statement. I've got another close friend who's both a chiropractor and a osteopath. He went to both colleges. And if you want to really know the difference between manipulation, go ask him, because he experienced in both fields. And he can unequivocally tell you chiropractic physicians are simply better trained and more highly qualified in spinal manipulation. Let's talk about education and politics for a minute. One of the myths I heard lately was faculty members of a chiropractic college have marginal academic background, and many have no college education at all. That's actually what this doctor said on video. And the reality is that statement is so ridiculous, it, again, doesn't even merit a response. I mean, politics, who has more political clout? Is there any lobby in the United States that has more political clout than the medical field and the pharmaceutical industry? I mean, to criticize chiropractic because of our political clout, I can only hope and pray we have that kind of clout someday. How about addressing the skeptic? Did you ever run into somebody that says, I don't believe in chiropractic? You know, what do you tell them? Well, my favorite thing to tell somebody that says, I don't believe in chiropractic, is simply this. Forget the word chiropractic for a second and actually focus on what we do in our office. And then ask yourself this. Just break down the parts, the steps you go through as a new patient. Do you believe in a history? Do you believe in a good thorough examination? Do you believe in diagnostic tests like X-ray, CAT scans, MRIs? Do you believe in forming a good accurate diagnosis? Do you believe in patient selection? In other words, after you form a diagnosis, of either accepting the patient for treatment or referring them on. Do you believe in that concept? Do you believe in treatments like electrical stimulation, ice, heat, therapies like that? Do you believe in exercise? Do you believe in patient education? Do you believe in nutrition? Do you believe in a re-examination? Do you believe in documentation? And do you believe that the good sound clinical decisions are based on, are evidence-informed in combination with clinical facts, unique facts about that patient, and patient values? Some patients choose medication, some patients choose a more conservative way. You know what? It's the patient's body, it's the patient's choice. All those factors come into play. So do you believe in all those things? Because if you do believe in all those things, then I got to ask you, then help me understand what exactly it is you don't believe about chiropractic again, because those are all things we do. The only thing I didn't mention was the term spinal manipulation, and the fact is, as we're going to see here in a minute, there's more research on spinal manipulation than any treatment that exists for the most common ailments that afflict patients: neck pain, back pain, and headaches. In fact, look at the next slide. Which of the available treatments, if I were to list all the treatments, passive therapy like electric stim, ultrasound, ice, heat, active therapy such as stretching, strengthening, core strengthening exercise, drugs, non-steroidal anti-inflammatories, other drugs like analgesics and muscle relaxants, other drugs like epidural steroid injections, traction, decompression therapy, acupuncture, biofeedback, trigger point therapy. Which of those therapies that are commonly used today have more research than spinal manipulation? The answer, none. None of them have more research than spinal manipulation. I would challenge anybody to produce more research compared to spinal manipulation. And this is probably my favorite myth to talk about. When somebody says there's no research on chiropractic, right? I think what they're really saying is there's no research on, well, I don't know what they're saying. What does that statement really mean? Because I got to tell you, just yesterday, just for the heck of it, I plugged in the keyword spinal manipulation under PubMed. And what did I pop up in about less than a second? 1,406 research papers. So I did the same thing on Google, and in exactly 0.25 seconds, 375,000 references popped up. I did the same thing on Manus through FCER. That database, that search engine, yielded 4,192 papers in a second. So for somebody to say there's no research, understand one of three things happen if somebody says there's no research. Either that person looked for research and couldn't find it, which kind of makes them incompetent, or they actually looked for research, found it, and ignored it, which makes them dishonest, or they didn't actually even look, which really makes them kind of a liar. I hate to say that, but I got to tell you, you better be careful if you're going to say there's no research, because you're going to be challenged. As you're going to see in a minute, there is a lot of research. In fact, if you look at national databases, national guidelines that are in existence today, in 1994, for example, the Agency of Healthcare Policy and Research came out with a document. It's a multidisciplinary panel, included, I think, 35 MDs and just 2 chiropractors. This is the document right here. And it showed, guess what? Spinal manipulation, the treatment of choice in non-complicated acute lower back pain. The National Council on Quality Assurance now lists spinal manipulation as a treatment of choice in acute and chronic lower back pain. Just recently, the American College of Physicians and American Pain Society, in the annals, as reported in the Annals of Internal Medicine, recommendation number 7, I'm going to show you that in a minute. Guess what recommendation number 7 is? Spinal manipulation. The only other treatment that they recommended besides spinal manipulation was NSAIDs, non-steroidal anti-inflammatory drugs. And we're going to talk about that in a minute, because there's some things about that you need to know. The American College of Occupational and Environmental Medicine, Official Disability Guideline, Millam and Robertson, all recommend spinal manipulation for acute and chronic lower back pain. The Council on Chiropractic Guidelines and Practice Parameters, which is this document right here, that arguably is one of the most comprehensive reviews of the literature that's ever been done in our history. And what did they find? Strong evidence, strong rating for chiropractic manipulation for acute, subacute, and chronic lower back pain, including sciatica and disc problems. Can't ignore the research. More recently, Bronfort did a study, is reported in Spine in 2008, just a couple months ago. Performed a study of all available databases called Evidence-Informed Management of Chronic Lower Back Pain with Spinal Manipulation and Mobilization. Obviously very, very supportive of spinal manipulation. So the research out there is so strong today that it simply can no longer be ignored. Oh, by the way, this I brought with me was the paper I talked about from the Annals of Internal Medicine that was a joint venture by the American College of Physicians and American Pain Society, and recommendation 7, spinal manipulation. Historic. It's absolutely a historic document. They say, for acute back pain, spinal manipulations, treatment of choice. Chronic or subacute back pain, spinal manipulation in combination with other things like exercise, acupuncture, massage therapy, those kind of things also work. So I'm not sitting up here saying that spinal manipulation is the only thing that works, because it's not. That'd be ridiculous to suggest something like that. But spinal manipulation as a core therapy is the treatment of choice. So my question to you is this: if you're a physician, a therapist, under what circumstance would it ever be ethically allowable, ethically okay, to recommend for your patients something other than the most effective form of treatment for a condition? Again, the research on manipulation is so strong. How can you not recommend it? And if you receive a referral, if you're a primary care physician and you're managing lower back pain, remember the research shows only 3% of those cases are actual disc cases that may need to go on to a surgeon. 97% of them are mechanical in nature that respond the best to spinal manipulation. So why would we not form relationships in an interdisciplinary fashion for the good of our patient to make sure that service is available? And why would we not send our patients to the providers most qualified to do that service and the most trained to do that service? I think you can see my point. It's very, very important. Now let's move on to the next issue, the safety of spinal manipulation. We're going to spend some time here. I'm going to do a brief mention of drugs, and we're going to be talking about what has appeared in this compilation of research called Current Concepts. We'll have a brief discussion of drugs regarding the use of drugs needed to treat neck and lower back pain. Just in a general sense, our society, and nobody would really argue much with this today, we're way over-medicated in our society, especially in the United States. In fact, it's gotten so bad that according to the Journal of American Medical Association in July of 2000, and also the British Medical Journal in March of that same year, they did a very responsible introspective review on the state of medicine and what drugs and hospital mistakes were doing to our society. And guess what? Death because of medical mistakes and drug reactions is now the third leading cause of death in this country. If you looked at the British Medical Journal, July 2000, and the British Medical Journal, March of that same year, you're going to find, I mean, they did a very responsible introspective look at their own profession. And what we found was deaths because of medical mistakes and drug reactions, unnecessary surgery. Are you ready for this? 225,000 deaths per year. It's now the third leading cause of death in this country behind only heart disease and cancer. It's a huge problem. And the estimates are conservative. They're for death only and do not even include the adverse effects associated with disability and discomfort. So it's a huge problem. So let's look at some of the other drugs that are commonly used to treat neck pain, and we'll balance that, put some kind of balance between that discussion and how safe spinal manipulation is. This particular paper I just found, cervical transforaminal epidural steroid injections more dangerous than we think. Right now, there's a big rage out there in doing epidural steroid injections. They're very expensive, and in some patients they work like miracles, in other patients they do a lot of damage. But a study that just appeared in Spine suggested that this study demonstrates a significant risk of serious neurological injury after cervical transforaminal epidural steroid injections. It is an absolute huge issue and something to be concerned. And I'm not saying that some patients don't need epidural steroid injections. Thank God when everything else fails that epidural steroid injections are available, so I don't have to send that patient to a surgery. So quite often it can help avoid a surgery. However, it should be the last treatment of choice before surgery. It shouldn't be your first option, obviously, because there are some significant risks associated with epidural steroids. This next study that was just in the Archives of Physical Medicine and Rehabilitation questioned the need to do a series of injections. And what these people found was there does not appear to be any evidence to support the current common practice of a series of injections. Recommendations for further research are made, including a possible study design. And again, I'm not suggesting that epidural steroids aren't valuable and aren't needed at times. I'm just suggesting that it shouldn't be a slam dunk issue. Everything conservative should be tried before a person subjects themselves to epidural steroid injections. What about NSAIDs, non-steroidal anti-inflammatory drugs? You know, aspirin, Nuprin, ibuprofen, those kind of things. How safe are those? Because it's one of the most widely prescribed drugs in America, probably the most ingested over-the-counter medication in our society. But look what this research shows. It appeared in the Journal of JMPT in October 1995. The best evidence indicates that cervical manipulation for neck pain is much safer than NSAIDs by as much as a factor of several hundred times. And we're going to go into that a little bit more. Current research shows that side effects of NSAIDs, the dangerous effects of non-steroidal anti-inflammatory drugs, are you ready for this? 16,500 people a year in this country die from ingesting those drugs. And that doesn't even count the ones that are horribly affected by gastrointestinal issues, kidney issues, liver issues because of those drugs. They are not safe little innocuous drugs. In fact, last year the FDA actually issued the strongest warning they have. It's called a black box warning on the use of non-steroidal anti-inflammatories. That came out initially because of Celebrex and Vioxx, as you know, but it didn't take very long for them to issue a warning against all non-steroidal anti-inflammatories. And that's why people are now looking to more natural therapies like omega-3 fatty acids, vitamin C. There's a range of nutritional therapeutics that work just as well without the side effects of NSAIDs that you might want to consider. Another study that was reported by Cochrane database for systematic reviews, NSAIDs may not be best for lower back pain. And look what they suggested. The literature on drug relief for lower back pain suggests that popular non-steroidal anti-inflammatory drugs are no more effective than other drugs such as acetaminophen, narcotic analgesics, and muscle relaxants. And look at the conclusion at the end. For lower back pain, evidence is conflicting that NSAIDs are more effective than simple analgesics or bed rest, and moderate NSAID use are not more effective than other drugs, physical therapy, or spinal manipulation. So be careful about those drugs. Just yesterday, interestingly enough, reported in a Columbus Dispatch, an AP News story, hospital foul-ups found in kids' care. What did they find? Studies more recently found that medical mix-up and caused by accidental overdoses and bad drug reactions harm roughly 1 out of 15 hospitalized children, according to the first scientific test of a new detection method. I mean, 1 in 15, folks. Think about that number. Now, some people worried about spinal manipulation causing cerebrovascular issues. Understand this contrast. The risk that we'll get to in a minute is 1 in 2 million to 1 in 5.85 million adjustments may cause a problem. Compare that to 1 in 15. It's unbelievable when you think about how safe manipulation is compared to other therapies. So how does one decide what to do? How do you decide what to do for your pain? I mean, the bottom line is, despite the evidence against NSAIDs and epidural steroids, for example, they do serve a purpose, they have a function, they have a place. And I am not standing up here, trying to convince you that you should never take those drugs. In some patients, they need those drugs. Some patients respond best to those drugs. All I'm suggesting is we physicians have to work together as a team, because there may be, and the evidence very strongly suggests, there may be a more conservative measure that can help that patient advance quicker and safer than those drugs. Patient selection is critical. Conservative care should be tried first. Epidural steroids way down the road along with surgery. Bottom line is, if you want to know about drugs, ask your medical physician or your pharmacist. If you want to know about chiropractic, if you want to know about spinal manipulation, ask a chiropractic physician. I've often found it odd that some people want to go check with their medical physician to see if manipulation's okay. I've always been confused by that. I mean, what do they know about manipulation? They get no training in manipulation in school. How could they possibly know? And you know what? Compared to them, I receive very little training in pharmacology. So when my patient asks me about drugs, my common answer is, you really need to ask your primary care physician about that, or your pharmacist, right? Go to the people that understand the issues. If you want to know about surgery, go to a surgeon, right? Bottom line, you patients, you need to become an active consumer. Get educated. That's what it's all about. Now I want to move into a different area and talk about chiropractic spinal manipulation and answer the question, how safe is manipulation compared to other common forms of cervical spine treatment? We're going to let you in on the inconvenient truth that certain chiropractic critics do not want you to know. All right? Let's start talking about information, again, that appeared in Current Concepts. How safe is manipulation? And do people that are supposedly suffering strokes, are they suffering those kind of things because of chiropractic manipulation? Interestingly enough, if you look at the slide, in 2001, Tourette did a study, and what he found was there's a tremendous amount of misuse in the literature by medical authors. It was almost comical. They asked the question, was the injury, got asked the question, was the injury really caused by a chiropractic physician? And what they found when they looked at all these cases, they found this. Actual injury in many of these cases were done by medical practitioners, medical specialists, osteopaths, physiotherapists, naturopaths. One of them was a patient, one a kung fu practitioner, one a blind masseur, a wife, and a barber in India. But yet, when a manipulation is performed by one of these people, somehow they call it chiropractic manipulation. Well, that's just not true. In fact, if you look at a study, if you look at the death and morbidity rates of common medical treatments reported in current concepts, chiropractic procedures are the safest procedures in the provision of human health care services when compared to no mortality and morbidity rates in medical practice. I mean, look at these numbers. In the United States, adverse effects occur in only 1 in 2 million neck manipulations. In Canada, when they looked at it, the study was 1 in 3.8 million manipulations. Other sources have it as low as 1 in 5 million manipulations. The fact is, it's a very, very, very safe procedure. Is there a causal relationship even between manipulation and stroke? Well, the best evidence has shown that no causal relationship exists between appropriately applied spinal manipulation and stroke events. In fact, the incidence of stroke in the population, believe it or not, is no difference whether you go to a medical physician or a chiropractic physician. There was a paper just released in Spine recently, 2008, just came out, risk of vertebral basilar stroke in chiropractic care. Guess what they found? When they looked at all the data, they found that vertebral basilar stroke is a very rare event in the population. The increased risk of stroke associated with chiropractic and primary care visits is likely due to patients with headache and neck pain from vertebral basilar artery dissection seeking care before the stroke. In other words, people were already into the event when they wound up going to their medical physician or chiropractic physician. And there could have been an issue of failure to diagnose and recognizing the symptoms that really was the main problem. According to the literature, you've got no more chance of having a stroke going to a chiropractor than you do going to your medical physician. In fact, when you looked at all the data in a 65-year period between 1934 and 1999, are you ready for this? There's only 37 known deaths because of spinal manipulation practitioners. Of those, only 19 in that entire 65-year period were attributed to chiropractors. And the reality is, even those ones may have already had the stroke in evolution. In other words, they may have been already in the event and the chiropractor was just kind of at the wrong place at the wrong time. And quite frankly, I've had personal experience with this. Years ago, I had my staff frantically come and get me out of my treatment room. And I came out to the reception room, and sure enough, there's little old Odessa, 80 years old, and she's flat out in the middle of a stroke. We had to call 911, rush her to the hospital. But guess what? That occurred before I'd ever seen her. Had that stroke happened just 10 minutes later, trust me, I would have probably been in a lawsuit, right? So a lot of these cases are already into the event according to the literature. And again, compare that 1 in 5 million possibility to the fact that 16,500 people in this country die every year from non-steroidal anti-inflammatories and related complications. So what are the possible risk factors that all physicians need to know? This is an important issue. We're not discounting the importance of stroke patients, and we're not discounting their injuries, and we're not minimizing the catastrophic effects that they experience when they have a stroke. But the biggest issue is recognizing those symptoms. So when that patient shows up in your office, again, whether you're a medical physician, osteopathic physician, chiropractic physician, or a physical therapist, you've got to recognize certain risk factors. And the published risk factors are this: dizziness, unsteadiness, giddiness, and vertigo, sudden severe pain. This is a key issue. Sudden severe pain in the side of the head or neck, which is different than any pain the patient has had before. If you see that, should send red flags up. Most strokes occur, believe it or not, in patients less than 45 years of age. Migraine headache is a risk factor. Doesn't mean you're going to have a stroke, just means you need to analyze that thoroughly, that's all. Connective tissue diseases are an issue. It's important to get a good thorough history, so you make sure you rule out those kind of issues. And recent infection, particularly upper respiratory infection. Now, interestingly enough, the etiology of these problems is beyond the scope of this lecture. We may do a future lecture on exactly why those are risk factors and what you need to look out for. But in addition to those risk factors, there's certain symptoms that should raise some flags. If a patient shows up in your office with headaches, dizziness, loss of consciousness, nausea, vomiting, hearing, visual, and sensory disturbances, they lose their sense of smell, lose their sense of taste, cramps, weakness, or ataxia without residual sequelae to suggest a stroke. I mean, all those things are symptoms that we need to be aware of. If that patient shows up with that presentation, red flags should go off. We need to do some more diagnostic tests, possibly an MRI, possibly an MRA, possibly a Doppler study to check the patency of the vertebral arteries and carotid arteries. All those are very important to consider. If we do a better job at catching these patients early, the possibility of that patient progressing to a catastrophic stroke reduces dramatically. And again, that doesn't matter whether you're a chiropractor or a medical physician. Those are issues that we all need to know about. Let's talk briefly about the dangers of NSAID use. We've already covered this. I'm going to cover it very briefly. But in Current Concepts, the author was unable to find any evidence in this document. This should be a must-read for everybody. They're unable to find any evidence-based clinical research to indicate the beneficial side effects of non-steroidal anti-inflammatory drugs in a treatment of cervical spine problems. Yet those are the most commonly prescribed drugs the patients receive. Very interesting. Only about 5% of all prescriptions are NSAIDs. Yet there's very little data showing it actually has a beneficial effect. In fact, this is really interesting. Brandt noted that not only is there evidence that NSAIDs favorably influence the progression of joint breakdown. In other words, you take a lot of NSAIDs over a long period of time and it actually helps joints actually break down. But not only that, but ongoing continual use of NSAIDs, non-steroidal anti-inflammatory drugs, actually accelerates joint destruction. So those poor patients out there that are taking anti-inflammatories to get short-term relief of that osteoarthritic pain, you're getting short-term relief, but you are sacrificing long-term stability in that joint. There are safer ways to control inflammation. But again, I'm not suggesting that some patients don't need these, because some patients, this is all that works. And thank God those drugs exist for that population of patients. But for a whole lot of patients, there are safer remedies. The dangers of NSAID continued. Dabbs found that it is seen that the risk of serious injury with NSAIDs, now think about this in contrast to spinal manipulation. The risk of serious injury with NSAIDs is 400 times greater than it is with spinal manipulation therapy. And the risk of death with NSAIDs is 160 times greater than it is with spinal manipulation. So if you're a physician out there, and you're one of those ones that may have been influenced by the critic we talked about earlier, trying to suggest that manipulation for the cervical spine is dangerous, I want you to consider what is really, truly, according to the literature, when you actually look at it, which is more dangerous, spinal manipulation, especially spinal manipulation done by a well-trained practitioner like a chiropractic physician, versus chronic NSAID use. I think the research is pretty doggone clear. The risk of death resulting from NSAID use is 1,500 times greater than the risk of tetraplegia following cervical manipulation. That's huge. The conclusion regarding the safety of spinal manipulation, on analysis, spinal manipulation clearly is the least invasive, safest procedure in all healthcare sciences for the treatment of cervical spine pain. In fact, the risks, look what the authors state, the risk of spinal manipulation pale when comparison to known medical risks. And let's just look at a few more studies. Cassidy just did a study that appeared in Spine. Again, in just 2008, we found no evidence of excess risk of vertebral basilar artery stroke associated with chiropractic care compared to primary care. Again, you've got no more chance of having a stroke going to a chiropractor than you do going to your medical physician, especially if the physician, whoever it is really good about identifying the risk factors and considering the complement of symptoms that the patient experiences. Now I'm going to briefly finish with the efficacy of spinal manipulation. How effective really is spinal manipulation? This is huge. I mean, there's hundreds and hundreds of studies that are far beyond the scope of this short lecture on why manipulation works and how well it works. The fact of the matter is, only 3%, again, of all spine pain is disc-related. According to the authorities, about 97% of all back pain patients suffer mechanical back pain that is the most responsive to spinal manipulation. Why manipulate a tight joint? Well, they've done studies, really interesting study in I believe this was done at Palmer College, but don't quote me on that. But what they did was they fixated the spine in a rat, and they looked at microscopically how it affected the joint. And what they found was in just 1 week, of a spine being fixated, there was irreversible damage in as little as a week of immobilization. That's unbelievable. You know, why are we so keen on taking care of spines on a proactive basis? Because if you let a spine get tight, it degenerates quicker. Of course, that study was done on rats, but think of your own spines. How many times have we seen patients? If you're a patient, how many times have you gone to a doctor and the doctor says, well, you just got arthritis? Well, I got news for you. That didn't pop out of nowhere. That developed over a long period of time, and it almost always develops because of one of two things. Either post-trauma that created joint spinal dysfunction that never got corrected properly, or the joints just were tight. For whatever reason, if we loosen those tight spinal joints, the patient does better, period. That's why we take care of spines. The most common symptoms you get when a spine becomes tight: lower back pain, neck pain, headaches. Those are the most well-researched symptoms, the most common reasons why a patient visits a chiropractic physician, for example, and also some of the most common reasons patients visit their medical physicians. Now, let's look at a study again that just came out February 2008, just 2 months ago. In the Bone and Joint Decade 2000 to 2010 Task Force. Again, a huge group of independent researchers. What'd they find? Manual therapy and exercise are more effective than alternative strategies. Manual therapy and exercise. The fact is, if you want to safeguard against back pain, or if you want to get over your back pain, whether it be cervical, thoracic, or lumbar spine pain, there is no better treatment than a combination of spinal manipulation and exercise. Period. No better treatment. Way back in 1996, Bronford did a study, and he compared spinal manipulation to spinal manipulation when used with strengthening or stretching exercises versus NSAIDs. And what did he find? For the management of chronic lower back pain, trunk exercise in combination with manipulation, where NSAID seems beneficial or worthwhile. Bottom line is, when you add spinal manipulation to almost any treatment regimen, it improves the outcome. That's what paper after paper after paper suggests. What about some different things that you might not think of going to a chiropractor for? Cervical radiculopathy. Every now and then we get a patient in our office who's been warned not to go to a chiropractor if you've got arm pain. Well, what's the research actually show? Well, this research that appeared just recently, it was a case study by done by Dr. Wayne Whalen. It is going to appear in the Journal of Chiropractic Medicine in 2008. What did he find? He looked at a woman that had neck pain, arm pain, provided spinal manipulation, and he found that this case describes a clinical presentation of a patient with a multi-level large disc herniations that improved significantly. So can you manipulate those spines that have disc herniations? Absolutely, you can. Excuse me. Another interesting study, what about pregnancy-related lower back pain? We see patients like this all the time. Can you manipulate safely a woman who's pregnant? The answer is absolutely yes. They looked at 17 cases of pregnant women. Look at this data. The average time to clinical improvement was only 4.5 days in approximately 2 adjustments. Now, why would we make women suffer that have pregnancy-related lower back pain when just an adjustment or two can dramatically reduce their symptoms without drugs, without therapy, without shots? What about whiplash when you get in a motor vehicle accident? Can those patients be manipulated safely? And the answer is absolutely yes. Medical researchers, Woodward and Cook, actually that was a chiropractor and an orthopedic surgeon, and some others in Europe, did a study that appeared in Injury Magazine 2000, or Injury Magazine. They found, I won't go into detail in the study, get it yourself if you want it, but they found that chiropractic treatment improved 93% of the patients. I mean, what other treatment do you know of that affects positively 93% of the patients they look at? That study was so dramatic that 3 years later they did another follow-up study to see if the first one basically was a fluke. Same researchers, what they find in that study? I know this sounds bold, but not my research, not my words, their words. Chiropractic is the only proven effective treatment in chronic cases. I know that sounds strong, but the reality is manipulation works, especially when performed by those best trained to perform the service. That's the way it works. What about disc injury in the lumbar spine? You know, can you manipulate a herniated disc? Because again, we get patients in every now and then, well, my physician told me not to get manipulated because I have a herniated disc. Well, what's the research actually show on that? Not opinion, what's the research show? Well, there's several different kinds of manipulation. One of the kinds is flexion distraction, and it's a table that bends, and when you bend forward, it basically draws that disc in, and they found basically very good results in that kind of manipulation to reduce the symptoms associated with a herniated disc. Cassidy did a study that appeared in JMPT in 1993, and he looked at side posture manipulation. Can a rotational adjustment to the lower back damage a disc? And what he found was the bony architecture of the lower back actually prevents the amount of rotation it needs to actually tear a disc. And when they actually looked at it, they found that the treatment of lumbar intervertebral disc by side posture manipulation is both safe and effective. There's no reason you can't have a bad disc case managed by a chiropractor. In fact, I would suggest there's just about nobody better to manage that case, especially if it's done in a multidisciplinary fashion with medical physicians, chiropractors, and possibly even physical therapists working together. That's what patients need. That's the way it should be in 2008. What about cervical disc? When I looked at manipulation, patients receiving chiropractic care for cervical and lumbar disc, and they followed these patients with magnetic resonance imaging, MRIs, they found 80% of those patients had a good clinical outcome. 63% of the patients studied revealed a reduced size or completely resorbed disc herniation after spinal manipulation. So absolutely, disc cases can be very effectively managed chiropractically. What about sciatica, that pain down the leg? What about that condition? Again, if you look at the study that appeared in Spine in 2006, they found that 55% of the active group were free of radiating pain compared to only 20% of the simulated patients. In other words, those who were receiving manipulation did tremendously better than those who did not with sciatica and disc protrusion. Now, this is a really interesting study that was just reported, ironically, just last week, early April, by Dr. Timothy Johnson, national TV. Everybody knows who he is. Well, there was a study that just came out. Actually, in 2007, the study came out. Why it took till now to publicize it, I'm not really sure. But they looked at a very specific form of chiropractic manipulation to the upper cervical spine. They took 50 patients, 25 of them they gave manipulation, 25 they didn't, and guess what they found? When looking at high blood pressure, the patients that were manipulated dropped an average of about 18 points and maintained that improvement 8 weeks later. And Dr. Timothy Johnson said that study is cause for significant review. More studies should be done. I mean, if you can lower blood pressure an average of 18 points, and they only did one manipulation, that's how significant that possibly can be. And then there's just some really interesting studies that are outside of musculoskeletal, outside of the traditional traditional condition you might think to go to a chiropractor for. There's one study that was reported in JMPT that looked at stable angina pectoris. You know, we see patients all the time that have chest pain, for example. They go to the emergency room, they can't find anything, they come into our office, we find a spinal dysfunction in your mid-back, we adjust and the pain goes away. Well, they actually looked at that, and what they found was 96% of the patients with that problem thought chiropractic treatment was beneficial. 96%. It's a huge study. 70% of the cervical thoracic patients improved with that kind of pain. So again, interesting, very interesting study. It calls for more research. On infantile colic, you know, you'd never think, who would think to take a baby to a chiropractor, right? And again, we see patients coming in all the time who say, oh, my doctor said never take a baby to a chiropractor. Yet, my reality in 26 years has been this. There are some mothers that are ready to blow their own brains out because they're dealing with infantile colic, those colicky babies, and nothing's working. Well, when they studied this issue, this study appeared way back in 1999, they found very significant improvement in infantile colic in a handful of adjustments in the upper cervical spine. The conclusion, spinal manipulation is effective in relieving infantile colic. Because let's face it, the birth process is very traumatic. And I'm not suggesting the doctors that are delivering babies are doing anything wrong. I mean, it's just a traumatic event for a baby. And when you look at the videos of a live birth, it would shock you how much stretch and turn is put in that baby's neck. Well, guess what? When your little bones up there misalign, they can't say, hey, mom, hey, dad, I hurt. What do? They get colicky, right? They don't have, in a great significant percentage, all this bile gas. They actually hurt. And when you do this tiny little gentle manipulation to a baby, don't forget, the manipulation to a baby is not like the same manipulation we give a 300-pound truck driver, right? It's exceptionally mild. The second we do that in babies that have colic, you see that little body just relaxing. It's an amazing thing to watch. So there's no reason you can't take a baby with colic to a chiropractor. The fact is we get great results with that in a majority of the cases. This is an interesting one. How about bedwetting? Again, not a typical problem, and I'm not suggesting that every case of bedwetting can be cured by a chiropractor. I'm not suggesting that at all. What I am suggesting is it warrants more research. It warrants some investigation. It warrants some consideration. Because when they looked at bedwetting and they looked at manipulation, what did they find? Results of the present study strongly suggest the effectiveness of chiropractic treatment for primary nocturnal enuresis. Patients that are bedwetters, I would highly suggest you get them to a chiropractor, get their lower backs analyzed, see if there's any spinal dysfunction that may be contributing to the bedwetting problem. We're really not sure of the mechanism of why that even works. But you know what? We're not really sure why aspirin works yet, are we? It needs studied. Again, I'm not suggesting in all these studies I'm sharing with you that they're definitive studies. It just suggests that it merits some investigation. It merits additional research. The last study I want to share with you actually is that occurred in the Department of Defense. The military did a demonstration project. They wanted to test and find out if chiropractic could have an impact in the military. And I got to tell you, this study was very dramatic. And what it showed was our armed services men and women that received chiropractic manipulation, here were the results. Unbelievable. There was cost savings projected because of the offsetting amount of physical therapy care these patients needed. There was cost savings with the reduction of inpatient events. There were cost savings as a result of duty and labor days that were saved by getting a soldier back into action or back into function again. There was cost savings by eliminating a lot of the durable medical equipment like back braces, home health, hospice, things like that with chiropractic care. There was an estimated additional savings of physical therapy substitution due to reduced emergency room visits and visits to the PCP. If those patients were going to a chiropractor, they weren't going to their primary care physicians, and the military was saving those costs. The approximate savings with that demonstration project, $25.8 million in net savings. And that was just a short-term project that showed tremendous benefits of the use of chiropractic care in the military. And the one thing I want to end with, the one study I want to end with, it talks about manipulation of anesthesia. But while manipulation under anesthesia is a cool topic, that's not why I have this study here. I have this study because of the one statement in this study that says this. The authors found that a multidisciplinary approach to evaluation and treatment offers better patient benefits above and beyond that which can be attained through individual providers working alone. And I think that is the message of today's lecture. Many times, patients can benefit by a multidisciplinary approach, medical physicians and chiropractors and physical therapists working together. Many times, those treatments working together work better than individual treatment alone. If all I do as a chiropractor is manipulate, that's not enough. If all I do is prescribe exercises, that's often not enough. If all the medical physician does is prescribe drugs, that's not enough. patients today need and deserve a good cooperative effort, good team approach by all us physicians, because let's face it, none of us do it all. Good Lord put us all down here for a reason. There's an abundance of patients out there. There's no reason for any turf war, no reason for any misinformation that some people like to spread about this profession. And I'm going to suggest to you, continue to do some research, continue to forge relationships. If you do not have a relationship with a chiropractic physician, I would highly encourage you to get a relationship. And lastly, understand chiropractic is a profession. It's not a treatment. Chiropractic physicians are primary care physicians whose job it is to consult, examine, diagnose that patient, and either accept them for care or refer them on. Every physician basically has the same role in that regard, and we chiropractic physicians are no different. So I want to thank you for taking the time to sit here this morning. This presentation, while it was produced and financed by myself, I got to tell you, this video is going to be available for purchase, and the PowerPoint presentation will be available for purchase, and the information for that is on the last slide. Thanks again for taking the time. I appreciate being here. I had a lot of fun. I hope you learned a lot. Have a good day.